A growing number of young San Diegans are still having symptoms several weeks or even months after getting COVID-19. Now, UC San Diego is starting to track these so-called long haulers. In fact, a local mother told ABC 10 News reporter Jennica Castner that she struggles today after testing positive last March.
Some health experts are now saying that the long-haul patient population may become a public health crisis of its own. When Jennica Harris in San Marcos got the coronavirus in March, she expected to bounce right back, but weeks turned into months.
And I'm 33, healthy, young, working out, worked out while I was pregnant, lifted weights, high-intensity workouts. And here I am, and I have this, slew of doctors that I have to go see, and trying to figure out why my heart is so high, my heart rate is so high, and I can't move from the couch, and I can't breathe 2 months after, 3 months after, 4 months after.
9 months later, this mother still battles severe shortness of breath. She's considered a long hauler, one of the growing number of post-COVID patients who suffer long after testing positive.
I was so angry for so long because I would see people outside partying when I could barely walk 2 feet to my window.
We already have several dozen patients, and we're starting to get in outside referrals.
Dr. Lucy Horton is working with a team of specialists at UC San Diego to treat local long haulers. Many are in their 20s, 30s, and 40s with no underlying conditions. They, like Harris, were never sick enough to be hospitalized when they first got the virus. Dr. Horton tells ABC 10 News the cause of ongoing symptoms remains unclear. It could be an autoimmune or overactive inflammatory response, and there's no one treatment. She says many of her patients have been ill for months.
What's really challenging as a physician in this situation is that we honestly don't know. And so when patients ask me, am I going to be sick for the rest of my life? I don't know if they're going to be sick for the rest of their life.
She, like Harris, encouraged young people to continue taking virus safety measures seriously.
The decisions that you make sure that you can live with those decisions.
According to a British study, researchers now estimate that about 10% of COVID-19 patients develop prolonged symptoms. Jennica Castner, ABC 10 News.